Hi, everyone. I'm Vic Gatto. Thanks for tuning in to Harnessing the Storm. I'm excited that you're here today. I have a great guest. Kevin Pereau is the founder of TranscendIT Health. It's an IT consulting firm in health and digital health. He's been doing it for several years. Super exciting guy. We dig into a lot of really great things in healthcare. Start off with the 3 waves of health innovation in digital health. So there's a wave 1, wave 2. We're just now starting the 3rd wave. Kevin will talk through that. Then we dig into the thesis that I've been talking about a lot, which is sort of the 4 trends that are going to disrupt healthcare in the next 5 years. Kevin and I sort of talk through that, kind of dig into a lot of that area. And then we dive into the difference between Silicon Valley, where he lives, and Nashville, Middle America, where I live, the give and take of how the health system works out on the coast versus Middle America, and how that's evolving over time. And then we dive into his book. He has an incredible book out called The Digital Health Revolution. It's a really great read. We talk through, he interviewed a bunch of experts on their point of view, and then wove it together into a book. Kevin Pereau, thanks for Harnessing the Storm. I appreciate you coming to visit with me. I'm excited to talk through everything.
Well, it's a pleasure to be here. Thank you very much, Vic.
Yeah. So as we've talked about, give everyone just a quick summary of your background with TranscendIT Healthcare and what you've been doing in your career today.
Sure. By the way, we just pronounced that TranscendIT, TranscendIT Health.
Okay. Okay.
We are what the analysts call a boutique digital health management consulting firm.
Okay.
We focus on strategy, business models, and then business development. I got into this around 2010 when I had my own consumer health company. We had a nice exit in Europe, and I have the benefit of working in a family where everyone's in healthcare. So from the pharmaceutical side to my daughter who's working in Boston working for a broker, we've kind of got the value chain covered.
Right. Good. Okay. So you've been doing it for a couple years at TranscendIT, is that right?
Well, actually, I come from a technology background. I started TranscendIT back in 2012. So prior to that, I had a consumer health scoring company that I owned and managed for 2 to 3 years. We did quite well in Europe and segued into consulting for digital health startups in the Pacific Northwest when we took a job up in Portland, Oregon. We've since pivoted, and we're now based out of the San Francisco Bay Area. We've been here for about 2 years, going on 3 now.
Okay, great. So a deep background in digital health and healthcare broadly, and technology even before that. Is that correct?
Oh, most definitely. I feel like we were part of the first wave of digital health. We were the first tech guys to get into the industry. Not just me, but the guys that were in wave 1 are still in it, and it's it's fun seeing what everyone's up to these days.
Yeah. So talk about that. I mean, I really like your concept of health and health 1.0, the second wave, third wave, maybe just now appearing, coming towards us. Talk through, as you see it, the waves of digital health coming to market.
Sure. In fact, that's a good point. I talk in 3 waves. I talk about digital health 1.0, 2.0, and 3.0. And digital health 1.0 was really back in around 2010, 2011. And I'm here to tell you, any of us that were looking for money back then, the winds were coming straight at us. There were no tailwinds whatsoever. There was a lot of skepticism. And I describe the early days as disproving the popular myth that people won't engage. I think overnight, thousands of healthcare apps just appeared out of nowhere, and we were buying many of them. So I think people started demonstrating that we were curious. We would be accountable for our own health if we had the right tools. That curiosity just exploded a whole new a marketplace of apps onto the market. I think the next wave was equally interesting. It was the whole quantified self movement. And you saw devices just exploded onto the scene, from fuel bands to Fitbits to sleep trackers. Heck, there was a device for just about everything.
Right.
Information that they're capturing real time and then connecting us to the stakeholders who can help keep us healthy and extending the value chain of who that might be. So historically, looking backwards, that's always been a clinician or a doctor. But I think looking forwards, it can be your fitness instructor, your nutritionist, someone that's helping you with a mental health or a addiction problem. The business model, I think, of engaging, capturing, analyzing, and reconnecting will be, and the challenge will be similar regardless of who we're connecting to.
Yeah, so it's interesting. It's kind of we've been gathering data and proving that we could do it. And now we're about to be able to connect in experts, whether they're MDs or counselors or coaches, and use that data to help us deliver a health outcome for ourselves.
That's exactly it. It's exactly it, Vic. And I think the other thing about that is relevant to each and every one of us. We all have a specific condition or a goal that we're trying to manage to. So the content that we might want to push to an individual might vary from group to group to group.
Yeah. And do you see it as me taking ownership of my own data and then for my own motivations, pulling out to different experts, or my insurance company or my employer or my health provider doing that?
I think it's going to be the latter, but I think curiosity of the former is what drove us to this point.
Okay.
If you take a look at all the data that we're now using, it's surprising how much of it has been generated by the devices on the consumer side versus on the clinical side, which, let's face it, a lot of the early generation products on the clinical side were really designed to keep hospitals in billing compliance and to get paid quicker. So they weren't necessarily designed originally with patient health in mind. Let's put it that way.
And not also patient user interface or how easy it is to engage with or use day to day.
Bingo. Let alone, who among us knows what our health record looks like, right? So we're kind of reaching an interesting tipping point where a lot of the data that we're finding value in using is the data that the consumer's been generating himself. Now, that's not to discount the value of clinically generated data, but I'm just saying we're a lot more savvy about how to use consumer-generated data at this point than we seem to be on the clinical side, which has been more really streamlined for billing.
Yeah, and as I'm sure you know, a lot of the social determinants of health are not really clinical in nature. I mean, I need to eat better, exercise, quit smoking, try to get myself oriented from a behavioral health point of view. And not all of those can be managed from a clinician's point of view directly. And so we need sort of a holistic view of health overall.
And if you think about the concept of data being portable, and portable in the sense that you can collect it, you can send it somewhere, you can analyze it, you can predict with it, and then you can reconnect it with someone who can help keep you healthy. You realize some wonderful things can happen along the way. You mentioned social determinants of health. What about the woman who's 2 bus stops away from taking her 3 children to go see the doctor? I think, telehealth and telehealth solutions is a way for connecting that woman with the doctor that's just out of her reach, but as important a need for her as it is for anyone else.
Yeah, and if you think about other industries, right, like I haven't gone and met with my stockbroker in probably years.
Right.
But I'm talking to him and emailing him and maybe talking on the phone once in a while and making trades. I can do all of that without meeting face to face. I mean, if he wants to buy me lunch to build a relationship, it's fine, but the real transactions are done much more fast in real time.
Yeah, well, you raise a good point. We've had a different way of structuring our relationships in just about every other industry, haven't we? I mean, from Hippocrates to present, the process has been the doctor knows best and the doctor decides what to share.
Right.
Well, I think as Dr. Eric Topol is demonstrating, increasingly you're seeing patients coming in that are educated and participative and want to play a role in their recovery process, and that's a good thing.
Yeah, that's a great thing. So I think one of the reason I started doing this show and what I've gotten more and more excited about is there's a prediction that I have that some people here in Nashville particularly get upset about. We're in the mecca for-profit healthcare here in Nashville. You're in Silicon Valley where they're used to disruption. in every industry. But I see the healthcare industry being disrupted pretty dramatically in the next 3 to 5 years and being completely remade kind of from scratch, really designed around 4 different trends that my venture firm is investing along. So I want to sort of lay those out and get your thoughts about them.
Sure.
The first is kind of the rise of the consumer, and your book is largely about that. We'll get to your book in a little while, but the consumer is going to sort of take much more ownership in the health journey, in the health decision-making process. I think care is going to move away from the hospital and out into the neighborhood or the home. I see technology tools, digital health and other technology tools, telehealth, like you mentioned, really growing in power and prevalence. And then I see market entry from non-traditional healthcare players like Apple, like Amazon, like Google, and others jumping in to sort of be your health provider, even though traditionally haven't been doing that. Give me your thoughts about those 4 trends. Maybe you see others. What's your feeling from the California?
Well, I think you've nailed it. I honestly think you have. I think at the start of this, you've had consumer curiosity that's just been driving a lot of the disruption that you're seeing in the industry right now. At some point in time, you'll see some consolidation, but right now, from an investment perspective, and just the sheer number of new participants on the scene, it's still in a white hot growth mode. You will hear industry insiders start to talk about maybe, is there a bubble coming? Today, no. The investment pulse is strong. The pace of innovation is still strong. You don't see artificial valuations or any shenanigans as people try to unload and dump, and get out at the last minute like you would see in any other sort of a bubble kind of a market. But I think that consumer curiosity has been quite strong. I think you mentioned that the players are changing, and I think the reason the players are changing is because we're starting to think about the healthcare value chain in an extended way. It wasn't all that long ago that you never would have thought a retailer like CVS would buy an insurance company like Aetna, or for that matter, a bank would team up with Amazon and try to create a new entrant that would seem to be focused on curing the inefficiencies.
As the consumer grows in power, right, that understanding of brand, customer service, product, price, placement, all those things that retailers and marketing firms know well sort of ascend in value and become much more important in the equation.
Oh, definitely. And I think the ways that you reach the healthcare consumer is changing. And you touched on it, I think, when you kicked off this question. The value chains extending out into the neighborhood, from the minute clinics to who you can connect with via your phone or through your iPad, whether you can or can't get to your scheduled appointment. So I think the challenges associated with keeping all of that tethered together and how you consume it are all driven by what we already carry around in our pockets right now, our smartphones.
Yeah.
And I think that's perhaps changed some of the most vexing and perplexing and daunting of challenges, and that's how do you get people to engage? Well, if you see people on their phones, you'll see them responding to notifications from LinkedIn, Facebook, Twitter, you name it. It's the same with healthcare, whether it's from your retail pharmacist, your doctor, your clinician, your fitness instructor, or your nutritionist. You're responding to the notifications, and they're engaging with you, and they're collecting important data that you can use in turn to help stay healthy.
Yeah, and so I think it's a combination of you're engaging with your smartphone around health and every other kind of interaction you're doing. But then there's also the Internet of Things applied to health, collecting data from other parts of my universe that then Bluetooth to the phone or connect to the phone. I have a scale, I have a Fitbit, I have other things that pull me in. I think eventually my car seat will be, enabled, and there'll be various places that are pulling information in that then I engage with through text messaging or through an app on my phone.
Right. Well, you mentioned home care, And I think home care is a great example of that, especially when you take a look at things like the challenges associated with hospice and home care for elderly.
Right.
The number of times that mom and dad get up and shuffle through the house, the number of times that they open up their refrigerator, how many hours they're spending in a prone position, and whether they're getting up and staying active.
Right.
It's not that far off that you'll be able to track all this stuff and get a notification that maybe mom and dad aren't moving around quite as often as they need to be, or maybe it's just time to check in on them. And what better way to drive that than seamless integration of devices throughout the house?
Right.
Most people.
Well, our society has gone so mobile, right, that I'm in Tennessee, but my mom lives in Minneapolis. I can't just drop by on the way home from work, but the technology can enable me to still sort of virtually check on her and
Absolutely.
then follow up and make sure she's okay.
Maybe even get a FaceTime chat,
Right.
For the personal touch.
At least my mom, she didn't care about technology until the grandkids came, and then she was all about technology.
Yeah, it's like what grandmom out there isn't a power Facebook user, right?
Right, exactly. So Kevin, I want to talk through sort of the timing of this market disruption. I think we both agree that the health and healthcare industry is going to go through massive change in the next 1, 3, 5 years. But healthcare is highly regulated, maybe for good reasons, maybe not. People's life is at stake, and so the FDA has a role to play. But regulation is challenging if you're an entrepreneur or a change agent like we are. And so change comes slowly in healthcare, maybe more slowly than other markets. And it's my thesis that the edges will evolve or be disrupted first. Kind of like a glacier melting, and then over time, as it goes, it sort of accelerates. Talk through what you've seen in healthcare IT and what your thoughts are around that idea.
Sure. I think what you saw originally were anything that was touched by the value-based care models really could consider to be a driver for digital health in healthcare. It really helped proliferate solutions that help capture data, analyze data, and help you take action on that data to get to a better outcome. So if you take a look at Medicare, Medicaid, children's health, what you'll see is it created an incredible explosion of both investment and technology to help you manage population health conditions.
Yeah, I agree completely. I think Medicare Advantage is going to be all of Medicare in the next several years. Like, it's just going to be Medicare Advantage.
Good point. And I think that the remuneration models for those programs is radically different, and it really drove a need for technology to be able to capture and better use data. The whole meaningful use.
Well, it creates incentives for payers to find a way to get me to be more healthy because they have more profits. It aligns incentives.
Well, exactly. And I think, as Andy Slavitt once famously said, the best way to help people lose less money is to prevent people from being sick in the first place, right? So it's one of the surefire ways of unclogging the system right there. But I think that was a real a low-hanging fruit driver, and what you saw was a proliferation of solutions like Omada Health and others that could help you manage your diabetes and help get you to a point where you could thrive with your diabetes, just by better connecting with you, providing you content to help you manage the condition, and then connecting you to clinicians and others who can help either intervene or with nutrition tips and exercise tips. Basically approach it more from a holistic perspective. But I think it's demonstrated that better outcomes are where it's at.
Yeah.
So what I would suggest is not just going to be a value-based care phenomenon.
Medicaid, maybe in certain states, have been the early adopters, and then the value-based networks have been early users of innovation and new change. What do you think is the next space where we should look for innovation?
Well, that's a good question. I think that what's keeping everybody up at night right now are we managing the triple threat as best that we can? Are we addressing things like health disparities? It matters where you live, right? I mean, here locally in the Bay Area.
Just for the audience, the triple threat is access, costs, and outcomes.
Absolutely.
Yeah.
And access is not something that we all enjoy.
Right.
It's a fair statement to say that the kids that grow up in Danville are healthier than the kids that grow up in Oakland.
Right.
And it has everything to do with access to care, affordability of that care. I mean, whether or not mom can get you to and from that care. So, I think that managing to those challenges are something that we've had hit or miss with. And I think some of the areas, some of the gaps, if you will, Vic, you haven't really seen people focusing the investment engine on things that don't necessarily pay a high rate of return on. And those are some of the very people who are afflicted with things that they can't change. I mean, the social determinants are not something that a single mom can just cure overnight, because she's got the will and the energy to do that. So as a result, we've seen a lack of investment in that space. And I would suggest that that's a good area for us to focus moving forward. I mean, it's been a gap. I think that in mental health and addictions, the low-hanging fruit coming right out of the gates were, all right, what are the diseases that are costing us the most money? And I think that that's where the initial investment went. That's where the skeptic would tell you that the initial investment went into making sure everyone got paid more quickly. But I think, the optimist would tell you, no, there's been some good things that have resulted from this whole phenomenon as well. And
So I want to kind of distinguish between out in California in the Valley and in what I'll call middle America. I think there is a need to, I'm a VC investor, right? So there's a need to figure out where the reimbursement pathways are.
Right.
I think access to care and social determinants and your zip code definitely need to be fixed, but they need to be fixed from an alignment of reimbursement, alignment of incentives, in order to allow innovators to flow in and solve these problems. I mean, a good friend of mine who works at Walmart, he was one drink in and then said, I can solve healthcare, but no one's paying me to solve healthcare like they are paying me to sell Coke and Fruit Loops, right? And so that is alignment of incentives and kind of the profit motive that some people are thinking about. That I think we need to get policy change to sort of align everything together, where it's better for the country, it's better for society, and you can have a profit motive to line all these things up.
I think that's a fair call out. And, I think to the profit motive, it's interesting. You hear a lot of, when you're talking about healthcare and the challenges associated with healthcare, you pretty much quickly figure out that you're actually talking about politics. Mm-hmm. One of the things that fascinates me about our U.S. system versus, universal healthcare in other countries is much of the innovation that you see to manage populations of health, cure a lot of the inefficiencies on the provider side, regardless of what your system is being driven here by the United States. In that, I'm not quite sure. I'm not passing value judgments or anything like that, because I'm totally committed to making sure that everyone in the United States of America has access to care. But one thing that I've come to appreciate from a technology perspective, diabetes doesn't discriminate. It doesn't care whether you have public care or private care. It's coming for your limbs if you're not taking care of yourself, which is why it's more fun to, I think, hang out with the technology guys and try to solve these problems, right? But and I
think I'll be interested. So I invested, I'm totally biased, but I invested in a company that is trying to prevent diabetic foot. So you bring up that. It's a terrible issue here in the South. I mean, in Tennessee, it's the leading cost for our Medicaid program. It's terrible in Mississippi and Arkansas. It's bad everywhere, but it's really bad in the South. A lot of diabetes in the South. And so we got working with Tennessee to try to figure out a way. I mean, the treatment is the same for the last 50 years, right? Like, if you have diabetes, you need to get your foot checked. If you get a foot ulcer, you need to get it treated. Unfortunately, people don't follow that behavior. They don't listen to their advice of their doctor or their kids or anyone,
right?
Because they don't have the pain. They lose feeling in their feet. They don't have the pain experience that we have. And it, like you say with the mom, sometimes it's hard to get into the doctor. After I take off work, I got to travel in, I got to get a ride. And one of two things can happen. Either the doctor says my foot is fine, so I've wasted a bunch of effort. Or the doctor says, I have a problem with my foot, which is super scary. Right? So from a human psychology point of view, if something is sort of negative to neutral, I'd rather avoid it. And like, I'll go to the doctor next week and next week and next week and next week, and I never go. And so we got to talking with some entrepreneurs and sort of tried to hack the psychology of it. And they're delivering pedicures and foot massages to people in their home, and then also checking for diabetic foot. And it's amazing, like if you call a diabetic patient and say, darn it, I need you to go to the doctor to get your foot checked, they hang up or they say, I can't do it. If you say, you know, I'm going to schedule a foot massage, can I deliver it next week to your house? They're like, sure. And so they've done
whatever it takes, right?
And then you gather all this other information about the patient, right? Like, what are they eating? What's the house look like? Do they have food in the kitchen? What is their sort of activities of daily living, what you call it from a clinician point of view? Because you enter from a point of view where they want you to come in because you're giving them a benefit.
You raise a fascinating, it's a fascinating scenario because I think, let's say you go do that for that person, then what do you do with all that data, right? I mean, you realize, okay, that person has a smartphone. I saw what was in his refrigerator.
Right.
He could probably use some tips from a nutrition expert to help him better manage, what is going to be a catastrophic event for him if he continues to eat and drink and not exercise the way that he's been doing it. And I don't.
Yeah, you're not coming in as a preaching nurse. You're coming in as a service provider. Let me help you think about this differently. One of the things that we learned through this process is they often burn their foot as the first incident because they step into the shower or bath. And so simply putting with a Sharpie, here's where you should turn the water. This is warm.
Yeah.
So it's often little things that are essentially free that make a big difference in people's health.
It's the human touch, right? It really is the human touch. And by the way, that was one of the reasons why I wrote my book. I'm from a tiny little village in upstate Vermont. I grew up in a town of 800 people, and a couple of my buddies had diabetes. And I asked them, what do you use to manage your condition? And they both laughed at me. They said, this is type 2 diabetes. I mean, we did this to ourselves. There's nobody out there that's going to help guys like us. And I asked them if they'd ever heard of Omada Health.
Yeah, there's entire companies to help you usually.
Oh, I know. And they said, Omada who? And I said, look, this is just an example, but you can prick your finger now and the values will go to a platform that analyzes and helps you take action when it's trending in the wrong direction. And if it's really trending in the wrong direction and staying there, you'll get a phone call from your clinician.
Right.
But it's a way of better staying in touch. And, behaviorally, what we've learned, just through years of consulting in this space is you can design an app to go off in Vic's pocket or Kevin's pocket as many times as you want. We'll figure out a way of turning that off. But who we can't turn off is our spouse, right? Yeah. I mean, if we were managing to a condition and the social inputs were coming from our loved ones, we found that that's a more effective way of using social agitation as a way of keeping people focused on doing the right thing.
Yeah, I mean, I think it's really interesting to take like the advertising Madison Avenue techniques, right, of figuring out what motivates you, whether it's sort of social proof, might be money, status, it could be sex, it could be achievement. There's only 6 or 7 different levers to pull, and advertising has gotten very good at, in 30 seconds, pulling a bunch of different levels and getting me to make a behavior change.
Yep.
You can start using that technology, that knowledge base, to get me to eat healthy or check my blood sugar levels or maybe go on a walk once in a while.
Most people think that that's the fascinating prospect of Amazon entering the picture, Vic. It's, the thought of, somebody thinking along the lines of, hey, patients who bought this often buy this, or patients who are managing this condition typically try these products. or eat these particular foods to get to a better place. It's kind of a fascinating way of thinking about it, because if you think about it, I mean, healthcare is one of those weird industries where the insurer makes the product. They sell it through a bunch of brokers who sell it to employers who provide it to employees. And you look at that and you're there, wow, the maker of that product is a long ways away from who he's designed for, right?
Yeah.
So,
and the physician typically has no idea what it costs the person he's serving. Like, there's no frame of reference of what things cost.
Oh, that's absolutely. I think that's changing, right? I mean, you're starting to see some cost transparency tools.
It's changing in
service
transparency. It's changing in some on the periphery. I'd say it's changing.
But it's not like shopping for a trip, is it? I mean, but what about healthcare really is? I mean, the whole travel analogy versus healthcare analogy oftentimes doesn't work, because when we're taking a trip, we know we're taking a trip. But we're in Las Vegas at a conference, we don't know we're going to get sick, do we? I mean, and then suddenly there we are.
Yeah, I think that's the challenge, and what I wanted to sort of just talk through is that healthcare is different in that sense, right? Like, if I'm in Vegas at a conference and I fall, all of a sudden I need healthcare when I wasn't planning it. And yet it's also, that's a crutch that a lot of existing establishment folks use to sort of hide behind their walled garden and maintain big profit margins, right? So I think it's sort of both.
But I think there's some clever technology guys out there that are figuring out, all right, how do we help the consumer, the little guy, navigate that labyrinth, right? One company comes to mind. It's an Israeli company, Vim. And if you use that example, his face probably turns white every time I use this example and use case. But
what's the company's name?
And you get sick, and you just wander into the highest cost venue out there because it was 2 blocks away, the emergency room. We've all done it, right? Vim is one of those amazing applications. You don't.
So Kevin, I keep missing it. What's it called?
It's Vim, V-I-M, like Vim and Vigor.
Okay,
I love this app because you don't have to download it. But if you wander into that emergency room, you'll get pinged by what amounts to this very sophisticated tool that's probably been provided to you by your provider or by your insurance company. It says, hey, Vic, is this really an emergency? And of course, there's a lot of science behind, the questions that they ask and the data that they can collect from you. But it's quite possible that you have an alternative that's a block away, that's in network, way cheaper and way better value. So I think, the technology that's connected to you by your insurance provider in many cases can help you save money and get you to the best doctor. And that's kind of exciting stuff too.
Yeah. So what I'm interested in, do you think there's going to be a kind of a tipping point where, let's call it the infrastructure, the technology, the data, the artificial intelligence, the apps, and the consumer brands and the go-to-market, the regulatory, all of these things we've been talking about that are kind of limiting innovation, limiting disruption, they all kind of aggregate together, and then there's a tipping point where now we're ready to go and everything flows.
Well, do you ever really get to that last point, right? I mean, in any industry, truly, I mean, I think what you're seeing is a lot of platforms emerge. So many of the elements of what you described exist. Like, you can do population health management, and you can do that soup to nuts. I mean, womb to tomb. You've basically got all the tools that you need. I think the AI is something that's quite fascinating for a lot of platform providers who are recognizing that, we've extended the value chain. We're collecting data every step of the way. There's got to be a way of normalizing it, benchmarking it, analyzing it, and predicting with it so that we can help our members stay healthy, because health is the new wealth. And I think the challenge associated with that every step of the way, whether it's a condition or you're just trying to stay healthy and eat healthy, is pretty consistent. So I think the model that we use is one that's going to be something that's extensible and something that we can just add components to. I like to think of it as applications in a stack, but the AI component largely doesn't exist today unless you're talking about someone's slide deck. I think that there are point references of where AI works, but not holistically. It doesn't look at all the data that you collect from multiple sources with an eye on helping Vic and Kevin stay healthy. But that's where we're moving. And
yeah,
I think
so I use the term tipping point because I think it's often the case in a lot of industries, and it's my thesis that we'll have it in healthcare in the next 5 years, that you sort of have these things going on beneath the scenes, and there are apps coming, there's data coming, there's AI only in particular use cases. I know a bunch of hospitals that are using it now to manage their own population.
Right.
There are like Vim is using it at some level for really particular use cases. There's some voice recognition. Those are AI, right?
Yep.
But they start to aggregate together and merge together, and then you and I wake up in 3.5 years, and you can do a lot of stuff now automatically in health, and the world has changed. I think that happened in other industries where you're kind of going along. Take the internet. People were going along for a long time saying the internet's overhyped, and the internet 1.0 and pets.com and all these things that had lots of excitement but no real delivery. But then we look up 10 years later and it's all here, it's all working, and
Right.
so it all came. And I think healthcare will be the same thing, that the press and the big incumbents are going to say no, it doesn't work, because they pick one case where it didn't work.
Right.
But entrepreneurs and innovators are going to keep working, and yeah, it didn't work this time, but let's keep making it better until there's a tipping point and it works.
We'll grind away at it. I think the fascinating thing about healthcare is, let's face it, everything's broken, right? So you can have a field day fixing this, that, and the other thing, and everything is incremental, right? I think at some point in time, you look for ways where you can, pull it all together. And I think platforms like that are emerging. I don't know if you've ever heard Rajiv Ranaki speak at Anthem, but he has a very genius vision for what he wants to do with building a platform at Anthem that's very member engaging, that connects very well and is integrated with all the things that you'd expect on the provider side, including how to get you to the best providers.
Right.
But it is an AI level that does much of what you had just described.
Yeah, so I think the payers are several steps ahead of the hospital and provider systems, right? So I think Anthem, UHG, and Oscar are all really well positioned and far ahead on all those fronts.
I think that's a fair call out. And it's funny, they've all taken a different route to get to the same place.
They're all a little different. They have different strategies based on where they started, right? But they're all really thinking about the new state of the world in healthcare and kind of preparing assets for that.
Oh, definitely. In fact, Mario Schlosser at Oscar Health was easily one of the more fascinating guys that we interviewed for the digital health revolution. Yeah. And, he's a typical engineering guy, right? He wants it to work. He wants it to work well. And he wants you to know that if he's offering it to you through Oscar Health, that it has been tested. It's industrial strength and bulletproof. Whereas, companies like Optum are kind of taking a different approach. They're basically, they've quietly become the big gorilla in the room. They make just about all the products that many of the other providers and payers use behind the scenes. Right. Each has taken a different kind of route. Aetna famously merged with CVS, so they've extended and done a different type of an integration.
They're the hardest one for me to figure out. I think Oscar is the most interesting because they're what you build if you don't have any assets, right? Just from scratch.
Yeah.
And it's really patient focused. I think honestly patient focused.
Very much so. Yeah. In fact, he might not use the word patient. He might use the word consumer. Yeah. But it's pretty fascinating. When you join Oscar, you get a concierge team, and they direct and steer you to whatever Oscar has to offer you.
Right.
So that part is pretty fascinating, and I like what they do there. I think that's a shopping experience for you. And if you're happy with what they have to offer, then you love Oscar, right? And what's not to like? They had, I think Mario famously said, look, the last thing I wanted to do was to start an insurance company. I really wanted to be the savviest tech guy in the industry. And I think that shows in the DNA of the company he built.
Yeah. Great. Well, Kevin, we're going to take our second break right now, and then we'll be right back. I want to talk about your book a little bit more. Right?
Okay, great. Thanks, Vic.
Okay, welcome back, everyone. I'm here with Kevin. He just wrote an incredible book that I want to get a chance to talk about. It's called The Digital Health Revolution, and I've read through it, Kevin. It's really an incredible book. I want to talk about a couple of pieces of the book.
Sure.
The first that really impressed me, I've talked about the rise of the consumer in lots of videos and been looking for it. And this book really, I think, did the best job I've seen really articulating what that means in healthcare. And there's a chart in here that I'm not going to show because it's going to not come up on the camera that much. We might try to find the picture of it. But you talk about your chart and that thesis that the patient is going to move into the center of the health ecosystem.
Sure. I think if you look historically at the information flow in healthcare, the doctor was literally right at the center of that universe, right? I mean, we went to him when we were broken and we needed to get fixed. He would or she would sometimes share with us a lot of information, sometimes share a little bit of information. Everything evolved around that doctor. I think the fundamental challenge that most people have with that is they like to think of themselves as the center of their own universe. And they like to think that, their needs come before the needs of anybody else, whether that's billing or whatever. So I think what you've seen is this just tremendous disruption driven by investment in technology over the last 8 years or so that's really put the consumer front and center, from shopping for benefits to scheduling an appointment to shopping for cost transparency on maybe what a knee replacement would cost. The way that we've even engineered the products in this industry has been sort of so many steps away from that consumer and that guy, and the very dynamic on which we use to sell to that person and how he consumes services that we provide him has changed fundamentally. I think
it's a really impactful part of the book.
Together.
I think it is a technology aspect, and you come from a technology background. I was also struck that as you get into chronic care management, right? So congestive heart failure, diabetes, et cetera, where you have to engage with the patient in changing their lifestyle in order to really have outcomes. You have to involve the patient really at the center with a team of people in order to get the outcomes. If I 100 years ago, if I fell and broke my leg and needed to be patched up, the doctor was the center because I was there, but mostly the doctor was sort of correcting the problem and sending me home. And now when we go into chronic care, you have to begin to engage the patient in a much more holistic and longitudinal way.
Oh, absolutely. And then the resource that you might want to use at any one point in time to help a person out can change, right? So much can be eradicated and better managed just with nutrition and nutrition alone.
And that was really interesting, is that the doctor is still in the frame, but you have lots of other people kind of around the patient supporting fitness, nutrition, diagnostic, the main physician, insurance companies, other physicians they pull in, other experts.
That's
and you go on from there, right?
And you're at the center of all that, and you're pulling it in as you need it, when you need it, where you need it. And I think that's the fascinating.
Like the data portability and data ownership should reside with the person. So then I can be pulling in, or they can on my behalf pull in the right experts, and they have all the data.
You raise an interesting point. We have generated so much information about ourselves through the devices and the phone apps that we've downloaded and we use. And what we're finding is that information is turning out to be every bit as valuable as what was in our clinical record at the hospital, right? So I think when you marry those two together, but you have an eye of, okay, we want to analyze, take action, and then reconnect with that person who can best help you take action in this one area, it's a pretty powerful model and a pretty powerful way of helping people stay healthy.
Yeah, I completely agree. And it'll be interesting to see how that continues to shift over time as we get more and more tools out there. Tell me about the process of writing this book. It was really exciting to read the perspective from, I don't know what you had, 20 to 24 different experts in there. I didn't count them, but a significant number of experts. That must have been a lot of research and a lot of fun to sort of dig in and have conversations with those folks.
It was all that. We actually interviewed 30 of the, I shamelessly went after the top minds in healthcare from, Andy Slavitt, who used to run CMS for President Obama, to Abdur Mason, who runs Consejo Sanyo, to a bunch of innovators and then chief digital health officers. And we didn't, shy away from the providers that were challenged by, how technology is disrupting them as well. So that aspect of it was pretty fascinating. And I found that sometimes the smartest thing to do is to ask questions and then step back and get out of the way.
Yeah, right.
You can learn an awful lot from that distinguished group of people.
So who do you think out of those 30 people, who was most surprising and who'd you learn the most from?
Well, that's a tough question. That's kind of like asking what's your favorite golf club, right? As soon as you say the 7-iron, the 9-iron is going to come back and shake on you. There were some that I found more inspirational than others, right? I really had a fun time talking to Andy Slavitt, and I think that, let's face it, when we get together and we talk about healthcare, too often the problem, the discussion focuses on the problems, and boy, there's never anybody that's got a shortage of opinions about all the problems that we have in healthcare. And Andy's just one of those wonderful guys who rolls up his sleeves and does something about it.
So let's talk about that more, because I've been following it. I don't know him, but I'm following him because, he's an insider.
Oh, yeah.
You can't get any more insider than running CMS, right? But now he's investing, and I think really trying to rethink the industry in partnership with the industry and pull in solutions for, I think he's the one that talks about that woman riding 2 buses, and we need a solution for her. And people that are disenfranchised or not connected in, let's pull them in and help. And he's investing like I am through Town Hall Ventures. So it's pretty interesting.
Yep. And I think, a couple things to Andy's credit, right? One is he approached this the same way he does everything else, right? I mean, I asked him some pretty tough questions. I said, Andy, do we really need more money in the industry? I mean, come on, this is your value add? He said, it absolutely is. And here's why. He said, I went to Oxyon Partners. So as we invest, I can place people, the very best people. He said the other people that are comprising the fund are the very people who would take these solutions to market. And they're the very people who recognize that, maybe measuring ROI isn't the most important thing we can be measuring with certain types of investments. And God bless him, he formed Town Hall Ventures to specifically focus on those that are suffering from social determinants. Right. And he's really going after all the hard ones that, let's face it, the low-hanging fruit. Investors, they count things. They just want to make money. Andy's stubbornly coming at it from the perspective of, no, we have some really stubborn and pervasive problems that we need to solve. So I'd say
the quantified self crowd in downtown San Francisco already is wearing 6 devices, right? We need to get into middle America where people are working 2 jobs and they don't have a lot of money and they need to feed their family and they got to get home to pick up the kids from school and they have all these pressures. How do we solve health for them? Right?
Well, I think with their participation, I mean, that's the best way to answer that question. I mean, you really can't solve healthcare with an ACO or an ACA alone, right? I mean, you just can't. I would really encourage everyone to channel their inner JFK, right? It's not what your government's doing for you. It's what you can do to help yourself. And I think those things are exercise. Think about what you eat. Drink less. I mean, if you did those 3 things right there, you'd be doing your part to stay healthy. And it's amazing how you can make a difference very quickly, taking the stairs instead of taking an elevator. Just the simple things that we can all do to keep our oars rowing in the same direction as the government programs and the innovators and the insurers and the providers that are trying to align with us so that they can be the best possible coach or advocate for us.
Well, I mean, one of the things I love about investing in healthcare is, as you said, it's a big market. There's lots of problems. And it's also very personal to everyone. Or like everyone has been in a health situation themselves, or they have a parent that has, or they've had children and gone through that process. Everyone, if you're human, you have interface with the healthcare system, and you like it to be better, and you'd like your own health to be better, to see your grandkids, or to see the next thing in your life. And that's really empowering to like help with that process. And simultaneously, it's over $3 trillion a year with tons of waste that needs to be better. So you kind of have both, right? The brands that are going to dominate health, not just healthcare, but health and wellness in our society, a multi-trillion-dollar business, those brands are being established now for the next 25 years. And yes, they will continue to acquire things, but you're sort of building the future huge multi-billion-dollar, multi-trillion-dollar businesses.
Oh, most definitely. And I don't think that the players that are going to dominate in this next sector are who you might have expected had you been asked that question 5 years ago.
Right.
And specific to that, I mean, the people the incumbents that I think that are faced with the biggest challenges, I think it's the insurance companies. I really do. If they're not careful, we're only going to talk to them when they goof up our claim, right? And I'm not being critical of any one specific insurer. I'm saying that as an industry, if ever there were a group of incumbents that had a vested interest in staying 2 steps ahead, it would be the insurance guys.
Yeah, it's interesting because I look at it, every day, and I think that's right. The future state of health, I don't think I need an ASO kind of managing claims for me in a provider network, right? I don't. That's not something that any big employer cares about. And the doctors, the health systems and hospitals and operating rooms and physicians are certainly going to be needed. But at the same time, the payers are moving much more quickly to try to figure out how do they reinvent themselves and stay relevant. And a lot of the providers that I see are kind of head in the sand. Things are going okay. We'll figure that out when we get there. There are some faith-based organizations or smaller groups that are very innovative. Kaiser out there with you all is innovative. But in general, I think the providers are behind, although their core value is much more solidified.
It's been, I think, more difficult for that particular incumbent to take the technology challenge by the bull of the horns, right? Because you have a provider organization that's as large as it is. So if you take a look at who's got the ability to invest in and benefit from something with economies of scale, it's typically somebody with deeper pockets. So it's historically not where it hasn't been the genesis of innovation.
Right.
And frankly, a lot of that came from places that we didn't expect anyways. A lot of the innovation in the early days of digital health was coming from MIT and Harvard and Stanford and universities that were just producing kids that were looking at our industry and going, are you kidding me? This is a solvable problem.
We've got to be able to do this
just
better.
Using the data.
Right.
So, I mean, God bless them. But I think you're right. I think the next wave is going to be dominated by non-traditionals. That's not to say everybody on the insurance side goes away or all the providers go away or anything like that, but it just means that the lines are going to get blurred. I think.
Yeah, I agree. The lines will get blurred, and I think the kind of protected moats of high margins are going to get attacked, right? Like you're going to have to be able to survive in a much more competitive world, and I'm not sure a lot of the incumbents are ready for that.
You're right about that. We could probably have beers and really have some fun talking about that. But, I think it's funny. 5 years ago, everyone coveted Kaiser's model, right? Because it was all integrated. And then CVS and Aetna came along and everyone was just absolutely going nuts about that. And then Amazon made their announcement. And so now people don't know what to think, right? You've really seen some untraditional partnerships form, but to be fair, they haven't.
I'm watching Apple Health. Apple's doing their own healthcare for their employees now
Yeah.
And I think that is a model that could be, I have no knowledge about it, but they could market that to other employers if they wanted to.
You know, Apple's fascinating. And I think that one thing Apple has as an advantage is they have access to consumers.
Right.
They have access
and
to
they
you
have
and I.
Probably the most trusted brand in the world, or one of the most trusted brands.
Absolutely. Absolutely. And they have unfettered access. And they can integrate it and proliferate it across any device that you or I would ever possibly need. On the downside, you know, they don't have the healthcare DNA. They don't understand the integration complexities. And I'm pretty confident that if anybody out there that's new, they'll figure a lot of that out. They're a fascinating company, and I'm a big fan.
Yeah, and what's interesting is whatever the name, right? You could pick Apple, Amazon, Google. There's a bunch of names you could pick. Their market cap and their cash balances such that they can acquire any competencies they need.
Yes.
To sort of integrate it. So say they need a particular, I don't know, physician network, they can go buy one for, you know, what would be an insignificant amount of capital compared to what they have on the balance sheet. So.
You know, I think while that's true, I think more than ever in healthcare, the person that they have to justify that as a strategy to is the person that they deliver the service to at the end of the day, because it is becoming more of a consumer choice for us.
Right.
And whether we use them or a combination of Optum United or Anthem, it really boils down to which one of you guys do I think is going to best service my needs based on where I am at this point in my life. Let the best solution win, right? We've lacked that in healthcare. We historically have lacked that from the, hey, I don't know what plan I'm going to get because I don't know what plan my company is going to buy, challenge to, okay, now I can buy 2 or 3, but it's still the 2 or 3 that they chose. You know, I think one of the coolest things about the ACA was just moving us closer to the insurer, the guy that actually makes the product for us, and forget the politics. I think it's kind of cool that they now have to treat me like I'm their customer as opposed to just some guy.
And sort of portability requires that, right? You can go to other companies and take your business elsewhere. So, and really insightful. I appreciate your time, Kevin. Thanks very much.
My pleasure, Vic. Thank you.